Good morning to everyone. I am Dr. Nica Taloma and I'm going to continue with my lecture on pathologic obstetrics. So when we talk about incompetent cervix, it is defined as a painless dilation of the cervical os without contractions of the uterus. This usually occurs at the 20th week. So first, we have to understand what the term incompetent mean. When we say incompetent in terms of work, if we have an employee or may nagtatrabaho para sa atin and we ask them to do a certain task and they were not able to do it, hindi nila nagawa with the quality that you are expecting or with the time frame that you have given them, hindi nila ito nagawa, we call that employee incompetent because he's not able to do the job that you gave him. So when we say incompetent cervix, the cervix was not able to do its job. Ano ba ang work ng cervix? First, you have to know where is the cervix located. So in this picture, we can see here, we have the uterus. And when we talk about the cervix, it is a part of the uterus and it is the most inferior portion or the lowermost part of the uterus. So we have here the cervix. So what is the function of the cervix when a woman is pregnant? The function of the cervix is to keep the pregnancy intact during the entire duration of the pregnancy. It means it has to be kept closed. Dapat nakasarado lang yung cervix natin to maintain the pregnancy. So we can see here, this is a closed cervix and then the yellow mucus is called the mucus plug. It means it covers the cervix totally. Now, here, we have here what we call an open cervix. So yung mucus plug na flush out na, lumabas na yung mucus plug and the cervix is now open. So again, when the cervix is closed during the entire pregnancy and only opens upon birth, we call that a normal cervix. But when the cervix usually at 20th week of age of gestation, it opened, we call that an incompetent cervix. It was not able to perform its function, which is to keep the pregnancy intact. So, anong characteristic ng incompetent cervix? It dilates. Pag nakita niyo yung term na dilation class, it means it widened its diameter doon sa opening niya. So, dilation, nag-open. And it is painless. Walang naramdaman si mother kahit ano. Sabi niya, Dok, wala naman ako naramdaman, wala naman masakit. Okay, this because it occurs without contractions, hindi naman nag-contract yung uterus natin. Diba normally pag manganganak ka, magko-contract dapat yung uterus and then saka mag-open ang cervix. But here, the uterus did not contract, walang contractions, but still, nagkaroon tayo ng opening of the cervix. Now, ano yung possible etiology? When we say etiology, ano yung mga possible causes nito? So first is, if the mother had a previous birth which is traumatic. What do we mean when we say traumatic birth? So, pwede kasing class, there are different types of traumatic birth. Pwede nagkaroon tayo ng precipitous labor. When we say precipitous labor, the labor occurred at a very short duration. Less than 3 hours lang nag-labor si mother, lumabas na si baby. That can be considered a traumatic birth. Ano pa? Macrosomic ang baby ni mother. When we say macrosomic, these are very large babies. More than 4 kilos in weight. These are the babies of our pregnant mother na nagkaroon ng gestational diabetes mellitus. So, kapag pinilit natin ang macrosomic baby to be delivered via vaginal delivery, pwede itong i-consider na traumatic birth. Ano pa? For example, in the previous pregnancy, pagkapanganak ng mother, kinailangan natin gumamit ng forceps to assist the delivery. Although, when we use forceps, it doesn't really mean na traumatic na agad yung birth. But if the forceps delivery was not done properly, then we can consider that as a traumatic birth. Siyempre, class, matutraumatize yung cervix. That's why, in the next pregnancy, pwedeng maging incompetent na siya. Hindi na niya kayang gawin its purpose to keep the pregnancy intact. Next, we have repeated DNC. Class, ano ang DNC? When you see that acronym, it means dilation and curettage. Diba? Letter D, dilation and curettage. Okay. Now, when you say dilation, again, sabi natin, idadilate mo yung cervix, i-open mo ang cervix, at saka kagagamit ng curette. If you remember our lesson in abortion, diba, ino-open natin yung cervix, tapos we have what we call that instrument, yung curette, yung parang pang-kuskus, i-curette mo yung loob ng uterus. So, kapag paulit-ulit, diba, ang layman's term natin dyan ay raspa. Paulit-ulit na naraspa si mother, pwede siyang magkaroon ng incompetent cervix. Because why? Mayroon tayong trauma class, maging traumatic ito sa part ulit ng cervix. Next, use of diethylstilbestrol while the patient was a fetus. Ano ba ang DES? Ang diethylstilbestrol is a drug. This is a drug na ginagamit nila dati, class, but right now, before, nakita nila na hindi magandang effect niya sa patient, kaya ito nagkaroon ng recall. So, tinanggal nila ito sa mga drugs natin na commonly ginagamit. So, when the fetus was still, when the mother was already a fetus, ginamitan siya ng diethylstilbestrol. Imagine, class, until her pregnancy, nagkaroon pa rin ito ng effect, which is incompetent cervix. Next, congenitally short cervix. First, let's define. When you see the word congenital, anong ibig sabihin nito? At birth, meron na siyang condition na ganito. Ipinanganak siyang ganito na siya. Yan yung tinatawag natin congenital anomaly. Meron na siyang problema. Pagkapanganak pa lang, meron na siyang problem. So, ang problem niya is a short cervix. So, dapat ganito kahaba ng cervix niya. Pero can you just imagine kung ganyan lang ka-short ang cervix ng mother? Kapag ganyan lang siya ka-short, of course, it will not be able to keep the cervix closed kasi very short siya. Any movement from the fetus will cause the cervix to open. Okay? And next, we have uterine anomalies. So, ang mga anomalies ng mga uterus pwedeng retroverted, anteverted, or prolapse ang uterus natin, then it may cause us our incompetent cervix. Okay? So, I hope naintindihan natin kung anong ibig sabihin ng incompetent cervix. Ulitin lang natin, incompetent because it was not able to do its job na i-keep yung pregnancy intact by a closed cervix. Ibig sabihin, at the 20th week, nag-open na to. So, pag nag-open ang cervix, class, take note, mahirap na ito na i-control. Okay. Now, what are the symptoms na makikita natin for an incompetent cervix? WF stands for watch out for. So, watch out for a pink, tinge, vaginal discharge. So, may lumabas ng vaginal discharge, di ba? Meron tayong tinatawag kanina, class, na mucus plug. Remember, in the last slide, mucus plug. Doc, yellowish naman. Bakit pink tinge yung sinasabi? Class, kapag nilabas mo ito, magkakaroon na rin magkakaroon ng mga bleeding. Small amount of bleeding. Kaya pag lumabas siya, pinkish ang color ng discharge natin. So, pinkish. Next, rupture of membrane, ROM. Rupture of membrane. Ito yung panubigan, di ba? Yan yung panubigan ng baby. Tapos, nung nag-open ang cervix, pumutok siya. So, ano makikita natin? May lumalabas sa puwerta ni mother na matubig. Hindi naman amoy ihi. So, parang wala siyang amoy. So, isipin natin, naku, pumutok na atang panubigan ng mo, nanay. Nag-rupture na ang membranes mo. Okay? Next, increased pelvic pressure. Bakit nag-increase ang pelvic pressure? Kasi, class, pag open na ang cervix, pag open na ang cervix, yung ulo ni baby, okay, magkakaroon na ng more pressure on that. So, yung pelvic area mo will have an increased pressure. Now, ito ang symptoms natin na i-watch out. What is the management, class? Okay, so the management that will be done is called a cervical cerclage. Take note, class, once na mag-open kasi ang cervix, if hindi natin ito ma-manage kaagad, what will happen is lalabas si baby. And if that occurs at 20th weeks, mababa ang possibility na mabuhay siya because the baby is too premature. Okay, now pag ikaw ay midwife, nurse, or doctor at nakita mo ang mga symptoms na to at 20th weeks age of gestation, kailangan mo bang mabahala? Yes, class. Because if you will not act upon it immediately, then the baby might die. So, ang treatment natin, we call that cervical cerclage. Anong ibig sabihin ng cerclage? Class, what we are going to do is to surgically or through the use of sutures, itatahi natin yung cervix para maging masara siya. Okay? First, we have what we call the McDonald's cerclage. This is a technique. So in this method, medically designed thread and needle are used, and the internal os is stitched together like the mouth of a closed purse or pouch. Internal os is the junction of the uterus and the cervix. So take note, class, ito ang cervix natin. Yan yung cervix natin. Now, class, meron tayong tinatawag na os. Ang os, pag nakita nyo yan, it means opening. Meron tayong internal os and external os. So, in this portion, yan yung tinatawag nating internal os. Ito, class. Itong opening na to, yan ang internal os. Yan. Okay, and yung opening sa baba, yan naman yung tinatawag nating external os. Okay? Now, when we say McDonald's cerclage, tatahiin natin yung sa internal os dito sa portion na to. Isasara mo siya using a purse string suture. Tingnan nyo yan, class. Purse string suture. Alam nyo yung lalagyan ng cellphone na hihilain mo? Wala na kasi hindi na siya uso ngayon. Pero parang pwede rin lalagyan siya ng mga shades or something. Pwedeng pencil case na meron ka lang hihilain tapos magsasara siya. So that is how the McDonald's cerclage looks like. Okay, I hope naalala nyo kung ano ang internal os. So ito yung opening between the uterus and the cervix. External os is the opening between the cervix and the vagina. So we have here a McDonald's technique. Another technique is, we call this the Shirodkar technique. So ito naman yun, class. Parang nagkaroon ka ng cerclage band sa labas niya. So that's the Shirodkar technique. Okay, now aside from suturing or cerclage, ano pa yung kailangan nating ituro kay mother? Of course, they have to take a bed rest. Imagine, class, kung open ang cervix ni mother at nakatayo pa si mother, nakatayo siya, open ang cervix niya, what will happen? The pressure, the gravity will cause the weight of the fetus to bear weight on that of the open cervix. Therefore, mas lalo siya manganganak. So, ano dapat gagawin mo? Dapat si mother, nakahiga siya. Okay, bed rest. Para si baby, yung gravity ni baby, pag ganyan, hindi siya pababa. Okay? Steady lang siya. Sorry. Next, pwede ba silang magkaroon ng sexual intercourse? Of course not. Open na nga ang cervix, mag-intercourse pa. That will cause more contraction or pwede mag-contract ang uterus upon coitus. Okay. Pag nagkaroon na ng rupture of membrane, o take note, class, Doc, paano kapag pumutok na yung panubigan niya? Pwede pa ba yun? Okay, class, pag pumutok ng panubigan, you have to prepare for birth. No matter how premature the infant is or the fetus is, rather, you have to prepare for its birth and still try to help the fetus survive. Okay? Pero pag pumutok na ang panubigan, manganganak na agad si mother. Dok, ibig sabihin, isa-cerclage mo lang siya kung hindi pa pumutok ang panubigan? Of course, class. Pag pumutok na ang panubigan, hindi mo na siya pwedeng i-perform ang cerclage. Okay, and of course, we have to take note, you have to address the emotional and psychosocial needs of the mother. Kasi of course, may stress yan. Kasi nasa kalagitnaan na siya ng pregnancy and then there is this threat of losing the baby. Kasi once na mag-open na ang cervix niya, wala na tayong chance to save the baby. I mean, pag pumutok na ang panubigan niya, rather. Kung hindi pumutok ang panubigan, kahit open ang cervix, we can still save the baby by performing the cerclage. Okay, now, I hope naintindihan natin lahat ang incompetent cervix. So, let's move on to our next topic, which is called the hydatidiform mole. So, we also call this H-mole. So, pag narinig nyo yan, H-mole, tandaan nyo yung meaning ng H is hydatidiform. Hydatidiform mole. So, everybody say that, hydatidiform mole. Or we also call that H-mole. So, H-mole is an alteration in early embryonic growth causing placental disruption, rapid proliferation of abnormal cells, and destruction of the embryo. Okay, now remember class, at the early part of development, meron tayong tinatawag na embryoblast, meron din tayong tinatawag na trophoblast. Now take note, itong embryoblast class, this will later become the embryo. Pag nakita niyo yung term na blast, it means immature. So, immature pa yung embryoblast and then it will later mature into your embryo. And this embryo, as it grows larger, magiging fetus ito. Okay? Itong trophoblast, on the other hand class, ito naman, later on, magiging placenta. So, I want you to understand that, ha? Yung embryoblast will become the embryo, which will later become the fetus. The trophoblast will later become the placenta. Now, knowing that the trophoblast will later become the placenta, ano ba ang other name ng hydatidiform mole? The hydatidiform mole is also known as your GTD or gestational trophoblastic disease. Gestational means during pregnancy. Trophoblastic. Class, di ba sabi natin trophoblastic? Dok, di ba sabi mo yung trophoblast magiging placenta? Yes. Pero bakit, Doc, disease? Okay. Why was it called that way? Kasi class, ganito yan. Di ba may embryoblast kanina, siya sana yung magiging baby. Pero ang nangyari, itong trophoblast, nagkaroon siya ng abnormal proliferation. Nagkaroon siya ng dumami ng dumami. So, nung dumami yung trophoblast, puro placenta na lang ang na-produce. Dok, paano yung embryoblast? So, class, since puro placenta ang na-produce, nagkaroon ngayon ng destruction of the embryo. Dok, ibig sabihin, nabuntis siya pero hindi nabuo yung embryo. Instead, puro placental material po ang na-produce? Yes. That's right. But this placental material is actually abnormal din. So, instead na naging placenta, naging puro trophoblast lang, dumami yung trophoblast. Okay, nag-proliferate ang placental tissues which are either villous or trophoblastic. Okay? Doc, ba't sabi dyan sa next line, with or without fetal development? That's right. Pwedeng merong ding namuo na fetus class pero abnormal, hindi siya buhay. Okay, incomplete ang growth niya. So, class, this occurs in 2.4 of each per 1,000 pregnancies in the Philippines. And in the Philippine General Hospital, it is as high as 14 per 1,000 pregnancies. Parang wala namang baby sa loob ng mattress ni mother, pero merong grape-like and fluid-filled vesicles. Okay? Parang may parang grapes sa loob lang, di ba? Bilog-bilog lang yung itsura niya. So, yan ang H-mole. Ano ba yung mga possible risk factors, di ba? Ito yung mga inaaral natin. Kailangan nyo malaman, sino ba sa mga nanay, ano ba yung history nila, bakit natin i-consider na pwedeng magka-H-mole na sila. So, take note, class, of the following etiology. First is the paternal age. When you see, ito yung mnemonic natin from D. P. Paternal age, yung age ng tatay. Pag ang nakabuntis kay mother ay may edad na, greater than 45 years old, there is a risk for a complete mole. Dapat tignan nyo naman yung age ng magiging asawa ninyo. Or dapat magkaroon na kayo ng anak before pa na mag 45 years old yung mapapangasawa nyo. Okay, next, racial factors. Pagka Pilipino ka class, there is a chance that 17.5 per 1,000 pregnancies ay maging H-small. So mataas. I-compare mo sa Japanese, sa Caucasian. Pag sinabi natin Caucasian, yung mga puti, mga Amerikano, Australiano, yan. And the Hawaiians, mas mataas ang sa Filipino. Okay, next, obstetric history. Anong titignan natin sa previous na pregnancies ng mother? Kung nagkaroon pala siya ng history of H-small dati, pwede ulit mag-recur. We have a 0.6 to 2.6% chance of recurrence. Nulliparous women with a history of miscarriage. When you say null, ibig sabihin 0, hindi pa siya nagkaroon ng pregnancy na umabot sa age of viability. Pag nakita mo yung suffix or root word na parus, this is a pregnancy that reached the age of viability. Pero class, nabuntis na siya dati, kaso lang nalalaglagan siya na a-abort. These pregnancies that does not reach the age of viability, so parati siyang na-abort. So kapag parati pala siyang na-abort, doc, mataas din ang chance na for H-small? Yes. Ano pa class? Kapag meron siyang twin gestation in nulliparous, meron siyang pinagbubuntis na kambal. Ano pa? After artificial insemination. Ano ang artificial insemination class? Ito yung mga procedure to help those who are couples who have difficulty getting pregnant. So kukuha ng sperm or semen sa lalaki at i-insert ito artificially sa vagina ng mother. So this can also be a risk factor for H-small. Next, sa PROMD, letter M stands for maternal age. Yung edad pala ng nanay, meron ding possible na risk factor. So kapag masyadong bata, less than 15 years old, there is a 20-fold increased risk. Mas mataas ang risk mo pag bata ka. Pag greater than 40 years old, that is a 10-fold increase in risk. Pero pag 50 years old, which is I think, meron pa mga nabubuntis ng 50 years old. Siguro ito, sobrang late na siya nag-menopause. Pero kawawa naman class kasi 200 times greater na ang chance niya of having H-small as compared to those women at the age of 20 to 35 years old. So this is due to abnormal gametogenesis and fertilization. Hindi na maganda yung fertilize dun sa egg cell. Abnormal na. Therefore, abnormal din ang result ng pregnancy. So, ang letter D stands for diet and lifestyle. Take note class ha, dietary carotene and animal fat as well as smoking can cause or can be a risk factor to develop H-small. We have to differentiate, although at your level class, you don't really have to be very particular on this, but it's very nice to know that there are two types of H-small. We have what we call a partial mole and a complete mole. So there are differences in the karyotype. When we say partial mole, ang normal natin na karyotype is either 46XX, that is a female, and 46XY male. So for a complete mole, normal naman ang karyotype niya. But for a partial mole class, we have an abnormal karyotype. So instead na 46 lang, nagiging 69 yung chromosomes natin. Plus, 3 pa yung sex chromosome. Dapat normally 2 lang yan, XX or XY, male or female. Okay, now, for a partial mole, meron ba siyang embryo? So sabi dito, it's often present. Pero dito naman sa complete mole, absent. How about amnion, fetal red blood cells? Of course, dito rin often present. Since ito wala siyang fetus, absent din siya. Okay, venous edema. Here we have focal, ibig sabihin sa isang area lang siya or sa iba't ibang area. Ito naman, diffuse, kalat-kalat na. Okay, trophoblastic proliferation, pareho sila, variable, slight to moderate sa partial, but in a complete mole, slight to severe. So, the diagnosis sometimes for a partial mole, dinadiagnose ito na missed abortion. Kasi nga may fetus. For a complete mole, we call that molar gestation. H-mole, di ba? Kaya molar, H-mole. Uterine size for a partial mole, maliit yung matres niya. Kasi nga, kukunti naman, ang trophoblastic proliferation niya is moderate, ito severe. Well, ang uterine size ng complete mole natin is 50% large for dates. Mas malaki yung tiyan nila. Ang laki naman ng tiyan niya. Akalain mo, kambal yung anak niya. Pero yun pala, meron siyang H-mole. Okay? So we have also what we call your theca-lutein cyst. So your theca-lutein cyst is rare this is a cyst na dumadami kapag may H-mole ka. And then medical complications are frequent for a complete mole. And class, pag yung H-mole, pwede siya kasing maging cancer. Okay? So we call that a persistent trophoblastic disease. So pag cancerous, more of the complete mole siya, 15 to 20%. Okay? Now, at your level, I want you to remember na meron tayong 2 types ng H-mole. Okay, this is how it looks like for a complete mole. Yan, walang fetus. Pero meron kang grape-like fluids-filled vesicles na madami. Well, for an incomplete mole or a partial mole, meron tayong fetus, pero pag makikita natin, hindi siya buhay talaga. And then, ito yung placental material that are trophoblastic. So, from history and physical examination, what can you find in each H-mole? So, we have here, when we perform a history and physical examination, of course, nagkaroon siya ng amenorrhea, absence of menses, kasi nga, nagbuntis siya, class. Okay, ang nangyari lang, hindi normal ang naging process or pag-develop ng fetal or products of conception. So, hindi siya nag-mens. Nung nag-PT siya, nag-positive. Okay, and then, nagkaroon ng vaginal bleeding in the first trimester. When we say trimester, in the first 3 months of pregnancy. Kaya siya kasi 3 months. So, pag first 3 months of pregnancy, we call that trimester. Next, absence of fetal movement and fetal heart tones. Okay, nasa 20 weeks pregnancy ka na pero wala ka pa rin maramdaman or walang maramdaman si mother na gumagalaw si baby. Wala rin tayong marinig na heart tones. Okay, what else? Passage of grape-like or sago-like materials. So next, we have uterine size greater than the age of gestation. So remember class, if a woman is pregnant, ito yung navel niya. Halimbawa, 16 weeks pregnant siya. Normally, dito mo mapapalpate ang fundus. Between the symphysis pubis and the umbilicus, dito yung 16 weeks. Pero pag may H-mole ka, yung uterine size mo will be bigger. Especially for a complete mole. 16 weeks pregnant pa lang, pero dito mo na napapalpate ang fundus ng nanay. Naku, ang laki ata ng tiyan mo, mother. Baka twins ang anak mo. Or, kung wala talagang walang fetal movement at heart tones, then probably H-mole nga yan. Anemia secondary to occult hemorrhage. So, pwede rin maging anemic si mother. So, how do we diagnose an H-mole? Class, first, of course, kailangan mo ng ultrasound. This is the most accurate and non-invasive. Ibig sabihin, ang gagawin natin is trans-abdominal ultrasound. Yung nilalagay natin sa tiyan, tapos lalagyan mo ng jelly, or ng lubricant, tapos ilalagay mo yung probe sa tiyan. So, it will show us a snowstorm appearance. Ano ba yung snowstorm appearance? So, here, when we perform a trans-abdominal ultrasound, this is what it looks like. So, parang snowstorm, parang bilog-bilog lang na parang meron lang snowstorm. Okay? So, that is for our diagnostic. Doc, bakit kailangan mo naman ipa-chest x-ray yung pasyente? Anong kinalaman ng lungs dun sa pinagbubuntis? Okay, that's a very good question, class. Take note, sabi kasi natin kanina, it may develop into a cancer. So, pag pina-x-ray mo yung lungs ni mother, nakita mo may bukol din, ibig sabihin nag-metastasize na yung lesion. That's why chest x-ray is warranted. But not immediately during pregnancy. I-chest x-ray natin siya after the pregnancy, kapag na-manage na natin yung H-mole. Okay, one of the diagnostic tests na kailangan natin gawin in the future is to check the chest x-ray. Okay, this is another picture of the snowstorm appearance in the trans-abdominal ultrasound. Okay, now how do we manage an H-mole? So first, we have what we call your chemoprophylaxis methotrexate. Doc, ano ang methotrexate? Okay, ito class, isa siyang gamot or it's a folic antagonist. Okay, bakit natin siya bibigyan ng chemoprophylaxis? Kasi nga, class, diba, there's a tendency that this will develop into a cancer. Ang methotrexate, ginagamit natin ito na gamot din for cancer. So, we want to prevent that. That's why we are giving the methotrexate immediately and also to decrease the production of the trophoblastic material. Second, you have to evacuate the mole. So, anong ginagawa nating procedure? This is our DNC, dilation and curettage. Again, we dilate or open the cervix and then we use a curette. Diba yung curette, maalala nyo, is an instrument na parang pangkuskus. So, in layman's term, we call that RASPA. Third, regular follow-up to detect persistent trophoblastic disease. Ito class, ang hindi nyo dapat kakalimutan as midwives, nurses, doctors. You have to take note class that you have to have a regular check-up after kasi baka nag-develop na ng cancer si mother. So, how regular? So, dapat meron tayong serial beta-HCG monitoring. Remember, beta-human chorionic gonadotropin. This is the hormone that is increased during pregnancy. So, anong ina-expect natin? Pagkatapos mong iraspa, ano ba dapat mangyayari sa beta-HCG sa dugo ng mother? Dapat bumaba siya, di ba? To the normal level na for a non-pregnant woman. So, ang gagawin mo, class, 1 week after mo iraspa si mother, 1 week after molar of equation, i-check mo na ang beta-HCG niya. Titignan natin, bumababa ba ito or mataas pa din. And then, after that, every 2 weeks until mag-normalize siya. And kapag normal na, every month for 6 months. Ganun pala yun, Doc. Kapag naraspa mo, hindi ibig sabihin okay na. Hindi pala ibig sabihin tapos na yung concern kay mother. Dapat pala tuloy-tuloy. Yes, so that we can prevent cancer. So, anong tawag ba natin sa specific cancer na to? We call that choriocarcinoma. Okay, everybody say that, choriocarcinoma. So, this is a type of cancer that may develop if an HMO was not followed up regularly. Next, Doc, ano pa tuturo natin kay mother? Class, you also have to teach the mother to avoid pregnancy for 1 year after diagnosis and treatment. Ay, Doc, bakit bawal siya magbuntis after 1 year? Kasi take note, class, if the mother becomes pregnant again, what will happen to the beta-HCG? Di tataas ulit yung HCG niya, di ba? Kasi nga pregnant siya. Now, how can we determine if yung pagtaas ng HCG niya is only due to the pregnancy or baka pala mataas din dahil may cancer na siya? So that is what we want to avoid. Kasi baka isipin natin, buntis nga siya kaya mataas yung HCG niya. That's wrong. Dapat class, hindi muna siya magbuntis. Okay? So pag hindi buntis si mother, pero tumataas pa rin ang HCG niya, ibig sabihin, mukhang cancer to, dapat gamutin na natin siya. We have to treat it early. Okay? So that is the management for our HMOL. So I hope class, you have learned a new thing or you have learned the most basic things that you need to know about HMOL. Now let's move on to the next condition. We call this Hyperemesis Gravidarum. So when we talk about Hyperemesis Gravidarum, it is defined as severe, excessive nausea and vomiting during pregnancy which may lead to electrolyte, metabolic, and nutritional imbalance. Take note class severe na nga, sobra na nga, excessive pa yung pagsusuka niya. Now, question, is it normal for a woman to have nausea and vomiting during pregnancy? Yes, diba? It's normal. That is because of the presence of the hormone HCG. Kasi nga tumataas ang HCG, kaya pwede talagang magkaroon ng vomiting ang mother. Pero should it be excessive? No. Hindi dapat yan excessive. Kung ang nanay suka ng suka, lahat na lang ng kakainin niya for that day ay isusuka niya, kahit iinuming tubig isusuka niya, that is already considered excessive and severe. Ang problem natin dyan, kung tuloy-tuloy, pwedeng manghina ang mother at magkaroon siya ng imbalance sa nutrition, sa electrolytes, at saka sa ibang metabolites niya. So, what are the different signs and symptoms? Sabi niya, unremitting, hindi tumitigil na pagsusuka. And then, the vomitus may contain already undigested food, bile, or even blood that is coffee ground. Nagkakaroon na ng pallor. Siyempre, magiging anemic ka na, suka ka ng suka. Your blood volume will you will be dehydrated rather, and then nagkakaroon na tayo ng dry skin. So as a compensatory mechanism, you will have increase in heart rate manifested as a rapid pulse. Pag nagkakaroon na tayo ng electrolyte imbalance, metabolic and nutritional, pwede tayong magkaroon ng acidosis which may lead to a fruity breath odor sa kakasuka mo. If it's really excessive, it may also lead to effects in our central nervous system. Meron ng confusion, delirium, headache, lethargic na yung mother, or pwede pa itong mag-lead into coma if it is not really treated early on. Anong etiology natin for Hyperemesis gravidarum? So, it may be caused by high levels of human chorionic gonadotropin in early pregnancy. Sabi natin, if this is too high, it may cause Hyperemesis gravidarum. Doc, kailan ba nagkakaroon ng too high HCG? Class number 1, di ba sabi natin kapag meron kang H-mole. So, ibig sabihin po ba, Doc, pag may H-mole si mother, isang symptom niya is Hyperemesis gravidarum? Yes. Pangalawa class, multiple gestation. Ibig sabihin, in one pregnancy, marami kang baby. Pwedeng twins, okay, triplets, ganon. So kapag mas marami kasing baby, mas mataas din talaga ang HCG na naproproduce ng katawan. So that will be one of the causes. Pangalawa, metabolic or nutritional deficiencies. Also, take note class, even the psychological aspect, meron siyang effect. If you have ambivalence toward the pregnancy, when you say ambivalence, you have two opposing feelings at the same time towards your pregnancy. Gusto mo, pero at the same time, ayaw mo yung pregnancy. So, ambivalent ka about it. So, it may also cause Hyperemesis gravidarum. Next, we have thyroid dysfunction. Okay, there's a problem with your thyroid. And then, nabanggit nga natin kanina, if you have GTD or gestational trophoblastic disease, also known as H-mole, it can also cause Hyperemesis gravidarum. And ito nabanggit na natin kanina, pag twins or triplets ang anak mo. Now, I forgot class, kailangan pala natin aralin itong term mismo. When you see the prefix hyper, di ba pag sinabi natin hyper, excessive, parang sobra. Emesis is a medical term that means vomiting. So, hyperemesis means excessive vomiting. Gravid, di ba? Pag sinabi natin gravid, pag nakita nyo yan, ibig sabihin pregnant. Ibig sabihin, a pregnant woman that has excessive vomiting. Kaya, Hyperemesis gravidarum. Okay? Now, how do we manage Hyperemesis gravidarum? Take note, class, kapag nagsusuka pa si mother, you have to put them in NPO. Nothing per orem. Bawal kumain, bawal mo na uminom ng tubig in order for us to help the mother have a rest sa vomiting para mag-stop siya. Since we know that the mother is dehydrated, we have to give IV fluids, intravenous fluids, and we have to monitor the intake and output to check if there is still balance. Next, we have also, kapag nag-stop na ang vomiting, ire-resume natin ang feeding ni mother, but it should be small, frequent meals. Pakonti-konti. Hindi mo siya bibigyan agad ng, kawawa ka naman, bigyan na kita ulit nito, itong pansit, kainin mo lahat, itong isang bilao. Hindi pwedeng ganon. Dapat pakonti-konti lang, class. And of course, you have to give antiemetics, yung mga pampatigil na pagsusuka. So, we have metoclopramide and other meds. And then, we have to maintain a non-judgmental atmosphere. Take note, class, ha. Huwag yung sasabihin na ang arte-arte naman ni nanay. Apaka-OA naman ng pagsusuka na yan. So, when you give those kind of remarks, that's already creating a judgmental atmosphere. Remember, they have no control about that. Kasi, class, it is caused by the hormone that is increased. Okay? So, that is the management for Hyperemesis gravidarum. Now, let's move on to the next common pathology that we encounter during pregnancy. We have what we call anemia. So, anemia, class, gusto ko lang din i-emphasize that it is not equivalent to having a low blood pressure. Pag sinasabi kasi ng iba, lalo na kung healthcare provider ka, future nurse, future midwife, future doctor ka, at sinasabi mo ang mababa ang BP ay anemic, that's very wrong, class, ha? Low blood pressure is not equivalent with being anemic. Take note of that. Hindi pareho yun. Okay? Blood pressure is not what we are measuring when we say anemia. Okay? Mali ito. Pag mababa ang BP, it does not mean that you are anemic. Dok, ano din ang anemia? When we say anemia class, ang tinitignan natin is the hemoglobin level. Take note in your anatomy and physiology class, ano bang hemoglobin? This is seen in a red blood cell, diba? Which gives it a red pigment or a red color. If the hemoglobin is less than 11 milligrams per deciliter, that is anemia. Ibig sabihin, class, you can only diagnose anemia if you check for the blood count, complete blood count of the mother, CBC. Sa CBC, titignan mo ngayon kung ano ang hemoglobin. Okay? If it's less than 11 milligrams per deciliter, we call that anemia. Check mo din ang hematocrit. If it is less than 33% during the second and third trimesters, this is also a parameter that we use to determine anemia. And when we say IDA, it means iron deficiency anemia. This is naman, class, the physiologic anemia of pregnancy. Take note, class, meron tayong tinatawag na physiologic anemia, which we have to compare to that of a pathologic anemia. So when we say physiologic anemia of pregnancy, okay, class, in the first trimester, what happens is the blood volume of the mother increases. So, for example, i-compare natin sa isang baso yung blood volume ni mother. Dati, class, before pregnancy, this is the fluid content of the blood of the mother. Tapos meron tayong mga enough na RBC. So, hindi anemic si mother. So, normal siya. But when the mother became pregnant, nagkakaroon tayo ng increased blood volume, dumadami. So, nadadagdagan yung fluid portion ng blood natin. But the red blood cell content is not increased. Therefore, parang nagkakaroon ng dilution. Kumbaga sa juice, parang nagiging malabnaw na yung lasa niya. Now, we call that physiologic anemia of pregnancy. Why? Kasi hindi naman nabawasan yung red blood cell natin. Normal pa rin siya. Kaso lang naging na-dilute siya. Kasi dumami nga yung fluid ng blood ni mother. Nagkaroon ng increase ng fluid portion of the blood. So, we call that physiologic anemia of pregnancy. Now, when we say pathologic anemia of pregnancy, pag it becomes as low as 11 milligrams per deciliter, or is as low below 11 milligrams per deciliter, then that is already called your pathologic anemia. Now, anong cause ng pathologic anemia? Nutritional deficiency. Di naman kumakain ng masustansya si nanay. Okay, ano pa? Acute and chronic blood loss. Meron pala siyang source of bleeding dati. Or, nagkakaroon tayo ng hemolysis, which may be caused by class malito G6PD and sickle cell. Okay? So, those are the possible etiology. Now, what are the different manifestations? Ano yung signs and symptoms na hahanapin natin kay mother? Kapag anemic ka, class, madali kang mapagod. Headache and tachycardia. Bakit meron tayong increase in heart rate? Because this is a compensatory mechanism for the blood loss or for the anemia that the mother has. Pag-check natin yung hemoglobin, 10.5 milligrams and below. Brittle fingernails. Meron tayong cheilosis or yung chapped lips na tinatawag. Smooth red shiny tongue or yung beefy red tongue. And for sickle cell anemia, pwedeng magkaroon ng painful crisis. So ito kasi yung mga other causes of anemia. How do we manage a mother with anemia? We have to give them green leafy vegetable as this is a good source of iron. Bigyan mo rin ng iron supplements. So turuan mo, mother, iron supplements are best absorbed on an acidic medium. So, pag hindi ka pa kumain, maganda na i-take mo na yung iron or pwede ka mag-take ng citrus juice together with the iron supplement for better absorption. Now, this iron supplements sometimes lang kasi class, pwede sila mag-cause ng gastric upset. Sumasakit ang tiyan ni mother. Kung gano'n ang nangyayari, you have to teach them to take the iron supplement after meals. Isabay na lang nila sa juice para ma-absorb pa rin siya. Bigyan din natin si mother ng folic acid supplement. Okay, and if blood transfusion is necessary, pag talagang mababa yung hemoglobin niya, i-transfuse natin siya ng blood. So, blood typing and cross-matching should be done to avoid transfusion reactions. So, provide support and management for patients with hemoglobinopathies. Okay, so that is our management for anemia. Next, the last topic for this lecture video are our placental abnormalities. So when we talk about placental abnormalities, here we see a normal placenta. A normal placenta class is implanted in the superior and posterior portion of the uterus, sa taas at saka sa likod na portion niya. This is a normally implanted placenta. Now, having seen and having known what is a normal placenta, ano ba yung mga abnormality ng placenta? So, we have what we call placental abruption, or ang other term dyan is abruptio placenta. When you see the word abrupt, it means agad-agad, di ba? Immediate. Abruptio placenta class, abruptly, humihiwalay na ang placenta sa uterus. Nagkakaroon na ng placental separation, abrupt separation of the placenta. Class, take note, Doc, kailan ba dapat maghiwalay yung placenta sa uterus? When does the placenta normally separate with the uterus? Magsiseparate lang yan dapat kapag nalabas na si baby. Okay, that's the time that the placenta will separate. Pero class, take note, in an abruptio placenta, nasa loob pa si baby, hindi pa siya na-deliver, pero humihiwalay na yung placenta sa uterus. Dok, anong mangyayari pag ganyan? Of course, class, remember, all the nutrients that goes to the baby via the placenta to the umbilical cord comes from the mother. Pag hindi pa linabas si baby at humiwalay na ang placenta, maka-cut off na yung supply between the mother and to the baby. Ano bang sinusupply ng mother? Oxygen. Binibigyan ng oxygen si baby. Binibigyan ng nutrients si baby. So kapag hiwalay na siya, ibig sabihin yan, wala nang supply na makukuha ang baby from the mother. And at the same time, pag humiwalay na yan, magbe-bleed na. So we call that abruptio placenta. Next, we have what we call placenta previa. When we say placenta previa, this is a low implantation of the placenta. Ulitin natin, saan ba dapat siya normally located? Superior and posterior, sa taas. Pero pag titignan natin sa placenta previa, sa baba siya ng implant. Na-cover ba niya ang cervix? Yes. Pwede mo bang ipanganak yan ng normal vaginal delivery or normal spontaneous delivery? Siyempre, hindi. Ano dapat yan? CS. Okay? Now, isa-isayin natin. When we talk about placenta previa, this is defined as lower segment placental implantation. And this is manifested as a bleeding which occurs in the last trimester. So, nasa third trimester ka na ng pregnancy, nagkaroon ka ng bleeding. And what is the characteristic class? It is painless. Take note ha, painless. Wala, hindi siya masakit. Painless bleeding in the third trimester. Okay. Now, again, a normal placenta is implanted in the superior and posterior portion of the uterus. We have different types of placenta previa, starting off with a low-lying placenta previa. When we say low-lying, okay, hindi niya na-cover yung cervix, pero nasa baba siya naka-implant. Okay, ay wow doc, ibig sabihin, kung hindi niya na-cover ang cervix, pwede natin itry ang normal spontaneous delivery? Yes, we can try it. Pero the success is not always 100%. Pero pwede mong itry. Pangalawa is a partial placenta previa. Bakit natin siya tinawag na partial? Because it only partially covers or obscures the cervix. Ibig sabihin, meron pang small opening pa din na naiiwan. Pwede ba tayo mag-NSD dito? Hindi na class, delikado na yan kapag ipipilit mo ang normal spontaneous delivery. That's why it's really important to do an ultrasound. Kasi the ultrasound will show us where the placenta is located. Kahit i-IE mo yan, i-check mo, hindi mo naman agad-agad ma-determine na placenta pala yon. Okay, and last, we have total placenta previa wherein we see that the cervix is completely covered. Talagang wala ka ng chance for an NSD dito. Okay, so I hope you understand the different types of placenta previa. Now, Doc, ano bang pwedeng mag-cause ng placenta previa? So, take note class, possible causes include multiparity. Ilang beses na rin nagbuntis si mother. Of course, syempre, pag ilang beses ka nang nagbuntis, yung placenta will look for an area in the uterine lining, endometrial lining, that is most ideal for implantation. Sa sobrang dami na ng pinagbuntis mo, hindi na masyadong ideal na implantation yung ibang lugar. Next, advanced maternal age, medyo matanda na si mother nung nagbuntis siya, or multiple gestation. So, if you can just imagine if this is the uterus and we have here baby number 1, yung placenta niya nag-implant dito sa taas. Baby number 2, okay, dito naman sa baba nag-implant yung placenta niya rather. So, multiple gestation may cause placenta previa. Okay, next, ano pa? Previous CS. Okay, previous CS may be an etiology or either other uterine incisions. And of course, prior placenta previa, dati na siyang nagkaroon ng placenta previa, then that is also an etiology. So, manifestations. So, naririnig niyo po yung pagtilaok ng manok because I did this video early in the morning. Okay, now, manifestations. So, we have bright red. Okay, bright red. Siyempre, nandyan na kasi yung placenta. Kapag nag-open ang cervix, magbe-bleed yan. Bright red talaga yung makikita mo. May pain ba? Wala. Because wala pa tayong contractions eh. Di pa naman nag-contract pero nagkakaroon na ng vaginal bleeding. Kaya painless siya. So, the abdomen is also soft kasi there is no contraction. It is not tender. And yan, it relaxes between contractions. There may be contractions sometimes, pero nagre-relax naman siya in between. Hindi kagaya ng abruptia placenta na ang pag-contract ng uterus ay tuloy siya. So, fetal heart rate is stable and within normal limits. So, doc, ibig sabihin pwede natin i-save si baby? Yes. So, how do we manage this case? First class, if you have placenta previa at meron ng maternal or fetal jeopardy, ibig sabihin, nakikita natin bigla nang bumababa ang heart rate ng baby, then we have to perform an emergency cesarean section. So we have what we call a double setup. When we say double setup, this setup is ready for a normal spontaneous delivery and a CS. Yan, kaya double. Pwede ka mag-NSD, available lahat yung mga materials na gamit for NSD or gamot. Pwede ka rin mag-CS kasi available din yung mga human personnel, yung mga anesthesiologists, OB-GYNs, pedya, OR nurse, okay, mga midwife, andun sila, available sila. Okay, that's why we call it double setup. So, we perform this double setup for those who have low-lying placenta. Okay, ito low-lying placenta. Pero kapag total and partial placenta previa, we perform CS. Okay? Now, conservative in hospital observation. Pwede rin kasing class, kapag stable naman si baby at preterm pa, wag mo munang i-CS. Kasi stable, okay naman si baby, tsaka preterm eh. Kailangan mo muna antayin maging mature siya. So, conservative management is done. Ano ibig sabihin ng conservative management? Complete bed rest si mother. Hindi siya pwedeng pumunta sa CR para umihi. Dapat talaga bed rest lang siya. And then, monitoring of the vital signs should be done regularly with pad counts. Titingnan mo kung gaano karami yung bleeding niya. Kapag severe na pala ang bleeding niya, then that means pwede nang the mother is already in jeopardy. Baka mag-hemorrhagic bleeding siya, hemorrhagic siya. And of course, most important, check natin si baby, yung fetal heart rate niya. Watch out for shock and dapat strict bed rest. Okay? Now, class, sabi dito, vaginal delivery attempt if greater than 2 centimeters from the edge, yung placenta. So, magbabalikan natin, okay, this is a low-lying placenta. This is the edge. Dapat greater than 2 centimeter ang agwat niyan para masabi natin na pwede nating itry ang delivery. Okay, vaginal delivery. So, that is for placenta previa. So, I hope naintindihan natin what are the different types of placenta previa, how are we going to manage a placenta previa, and what are the signs and symptoms. So that now we move on to the next type of placental abnormality, which we call your abruptia placenta. This abruptia placenta, as we have mentioned earlier, it is a premature separation of a normally implanted placenta after 20th week of pregnancy, typically with severe hemorrhage. So remember, we mentioned earlier that yung placenta, normal naman. Yung pinag-implantan niya, it is located superior and posterior of the uterus. But it is separating prematurely. Nandun pa yung baby sa loob, humihiwalay na siya. So, pwede siya magkaroon ng severe bleeding. Okay, ano yung risk factors ng abruptia placenta? If the mother had a previous pregnancy with abruptia placenta, pwede ulit siya magkaroon nito. Increased age and parity. Matanda na si mother o kaya multiparous na siya, ilang beses na siyang nagbuntis at nanganak. Preeclampsia, mataas ang BP during pregnancy. chronic hypertension. Okay? So remember class, ang blood pressure ng mother kailangan natin frequently i-check. Hindi yan BP lang naman. Huwag na natin i-BP, parati naman nating bini-BP. That's wrong. That's very wrong. Kasi the BP of the mother may be normal in the first trimester. It may also be normal in the second trimester. Pero pagdating ng third trimester, taas pala ng BP niya, hindi mo na chinek. You are the midwife or you are the nurse at hindi mo na chinek. At ngayon, nagkaroon ng abruptio placental, namatay ang baby. Are you liable? Oh, of course, you are liable for that. Okay? Next, chorioamnionitis. When you say chorioamnionitis, when you see the suffix itis, it means infection or there is an inflammation in the chorion and amnion. Ano ba yung chorion and amnion? These are the layers of the amniotic sac. Okay? So, nagkaroon ng infection. It may cause abruptio placenta. Preterm, premature rupture of membrane, pwede rin siya mag-lead into abruptio placenta. Ibig sabihin, preterm pa yung baby, pero pumutok na yung panubigan niya. It is also a risk factor for abruptio placenta. Ano pa? Multifetal gestation, low birth weight, hydramnios, masyadong maraming amniotic fluid, excess greater than 2,000 ml. Also, cigarette smoking, thrombophilias pag may blood disorder, or nagda-drugs ang mother, gumagamit siya ng cocaine, or meron siyang myoma sa uterus. This may all lead to abruptio placenta. So, yan ay mga kailangan yung tandaan na possible causes of abruptio placenta. So, what is the triad? Ano ba yung tatlong symptoms na kailangan nating tandaan to consider abruptio placenta? Number 1, there is a bleeding in the last trimester that is painful. Naalala nyo kanina class sa Placenta Previa? Pag sinabi nating Previa, ang bleeding niya ay painless. Pag abruptio placenta, painful. Okay? Tandaan nyo yan, lalabas sa exam nyo yan. Pag abruptio, painful ang bleeding. Nagbe-bleed ka sa third trimester pero painful. Diyan mo ma-differentiate ang etiology natin if it is a placenta previa or abruptio placenta. Next, normal ang placental implantation. We have been emphasizing that. And another part of the triad is DIC, which stands for disseminated intravascular coagulopathy. Disseminated, ibig sabihin kalat-kalat na nagkakaroon ng clotting sa katawan ng mother. So we have here partial separation. Meron pa ring portion. Ito lang yung nag-separate. Meron pa ring portion na nakakabit. Meron ding marginal separation. Yung edge niya lang, isang edge niya lang ang naghiwalay. Meron namang complete separation with concealed hemorrhage. So, completely separated na siya. Pero the hemorrhage is being concealed kasi hindi pa siya lumalabas dyan. Okay, now how do we manage an abruptio placenta class? We manage an abruptio placenta through an emergency CS if the patient is in active labor. So again, take note double setup. Pwede nating i-NSD, pwede din nating i-CS. Pero sabi niya, pag nagle-labor na ang mother, i-CS mo na agad yan. Huwag mo na siyang antayin na i-NSD. So again, vaginal delivery attempt, ito, iba't mali ito. Di ko lang natanggal, this is for the placenta previa. The nursing management, so the same, kasi may bleeding tayo, we have to always check for the vital signs of the mother. Baka pala wala na siyang BP, hindi mo na mapalpate, palpatory na ang BP niya. Kasi severe na ang bleeding. Okay, pad counts, titignan mo ngayon, nakakasaturate na siya ng 1 pad in 1 hour. That means, that already gives you a clue na masyado ng heavy ang bleeding niya. And of course, we have to always check the status of the fetus. Check natin yung fetal heart rate and watch out for signs and symptoms of shock. Put the mother in complete bed rest in lateral position and you have to insert a large gauge IV catheter. Lagyan mo na siya ng swero na malaki yung gauge ng needle niya kasi bakit natin gagawin yun? Because we have to anticipate na baka mag-blood transfusion tayo. So we are going to use the gauge 18 needle. Okay, so I hope we understood the difference between an abruptio placenta and a placenta previa. We have to take note that these are third trimester bleeding. So, nangyayari lang siya sa last trimester. And you have to take note the different characteristics. For a placenta previa, it's painless. For abruptio placenta, it's a painful bleeding. For a placenta previa, malambot or soft and non-tender ang abdomen niya, with contractions, nagkakaroon ng relaxation in between, kung sakali man may contraction. While for an abruptio placenta, tuloy-tuloy ang pag-contract ng uterus. Ito ay tender and rigid, matigas. Okay, so I hope that you have learned something in our discussion for today. Please expect that there will be other lecture videos as well for the other disorders in the antepartum portion of the pregnancy. Thank you so much and have a great day. For example, in abortion, it causes 8%, infection or sepsis 2%. So this may